Dr. Matthew Maggio. I'm here at my office inside of SPSC CrossFit. I'm going to do a little bit of talk today just about scar tissue and adhesion. So when people think scar tissue, they always think that you have to have an actual direct injury to get that. So a car accident, a trauma, a crush, a tear, anything like that. You go in, muscle rips, body goes in and fills it in with scar tissue. That's what people think is the only way to really get scar tissue. That's actually not true. That's only about 10% of the time. The other way to get scar tissue is basically a muscle has one job. It needs to contract and relax. That's all it needs to do. But over time, when we repetitively overuse muscles, it puts the muscle in a state of constant contraction, which allows not enough blood and oxygen to get in, which can cause a state of hypoxia. And what happens is little tiny pieces of scar tissue and adhesion develop in the muscle. Over time, this scar tissue gets bigger and bigger. Before you know it, it's like someone went and poured glue inside the muscle. Now it loses flexibility, strength, blood can't get in, oxygen can't get in, waste product builds up. And what it does is it really starts to alter that range of motion. Usually in the beginning, your body doesn't care, and it starts to pass it off to a neighboring muscle. And you begin to compensate. But before you know it, that whole process starts again, and you develop more and more scar tissue. Before you know it, the scar tissue is in a lot of muscles all over the place, and what it does is really limits your range of motion. And also, when you use the muscle, it just hurts because it creates a lot of tension points. So here's a really cool thing about scar tissue is there's no magic way to get rid of it. You can do all the foam rolling, stretching, injections, chiropractic adjustments, massage therapy. You can even run around in a circle and rub your hands together and hope it goes away. It's never really going to go away without the right kind of treatment. So what we're trained in here at Peak Performance Sports Therapy is actually finding this scar tissue and getting it out of there. And the only way to really get it out of there is to put the muscle in a shortened position. When you do that, it allows me to get depth and access to the scar tissue. What we then do is have you go through a full range of motion. As we do that, it creates a lot of tension and builds up. And what happens is this scar tissue starts to break away as we force it to roll over my thumb. We hold some pressure, do about 5 to 7 passes, and then we go back and we recheck the motion. If we effectively treated the right area and the right scar tissue, that range of motion should be instantly improved. And then we should also wait a couple days and check it again, and it should be even better than where we finished or right where we started. And what we want to do is see that that's a lasting type of improvement. The thing about massage therapy and chiropractic is they don't actually address the scar tissue. They actually just work with the tissue around there and never actually get the scar tissue out of there. So you might feel good for a while, but you never actually get fully better. What we're about here is sustainable and dramatic results that last and last and last.